Hello everyone, welcome to Medical Ward BSN 3F Group Number 1. And of course, today we are still here at Maria Reina Xavier University Hospital, Station 2A. And of course, we are on a morning shift. And of course, this is going to be our week number 2. And this week number 2, our focus is all about understanding a little deeper about diabetes mellitus type 1. And that will be our focus for our case study number or case scenario number 2. But before we proceed our case, I would like to share this premise to you. I am here for you. It's literally my life's work to help you grow. And of course, it's not that I will only be helping you, but it's also going to be very important for you to help yourself, especially because, of course, you have your passion. You have your dreams of becoming future Atenean nurses. Before we proceed to the case, let me share with you our learning outcome for the week. On completion of this case study, student nurses will be able to, first, build a knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contribution of student nurses in the care of medical patients. Fifth, justify optimal therapy based on the current understanding of the case. So these 5 learning outcomes will be the basis of our expected outcomes or expected output at the end of the case scenario. So it is expected that you will actually satisfy all of the 5 learning outcomes in order for us to say that you have already developed a deeper understanding of the case, which is diabetes mellitus type 1. And also, just a reminder, this is going to be the reminder of the instructions that was given to you before. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, and of course, as much as possible, avoid flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Again, please follow the format of your output, especially on its font style, font size, paper margin, or paper size. I've already given you that one, and of course, I hope that you have to continue following that format. Next is save it as PDF file and submit all your requirements per group on date specified as its deadline. And of course, I have given you information already on how to save your file based on your family name, the section, and of course, the subject that you are going to submit. Please follow that also because that will help me in identifying in the monitoring of your requirement submission. Send all your requirements via the official email address of your clinical instructor, and it is advised that you will submit all your requirements on or before the set deadline of submission. Let's now have the case scenario of patient CD with diabetes mellitus type 1. Please allow me to read the case. CD is the first patient you meet in the medical ward for the week at Maria Reina Xavier University Hospital. A 25-year-old female, a Roman Catholic in faith and from Inita, Misamis Oriental, and is diagnosed with type 1 diabetes mellitus. 9 days ago, CD went to see the physician after a month history of frequent urination, thirst, severe fatigue, blurred vision, and some burning and tingling in her feet. She attributed those symptoms to working long hours at the computer. Her random glucose level was 410 mg per deciliter. The next day, her labs were as follows: fasting glucose of 335 mg per deciliter, HbA1c or your glycosylated hemoglobin of 8.8%, cholesterol of 310 mg per deciliter, triglycerides of 300 mg per deciliter, high-density lipoprotein of 25 mg per deciliter, low-density lipoprotein of 160 mg per deciliter, ratio of 12.4, creatinine of 0.9 mg per deciliter, and body mass index of 37.6. Her BP is 160/96 mm of mercury. She was admitted to the hospital for control of her glucose levels and the initiation of multi-dose injection insulin therapy with carbohydrate counting. Prior to her discharge, CD has been referred to you for comprehensive education. You are to cover 4 basic areas, and that includes pharmacotherapy, glucose monitoring, glucose monitoring, medical nutrition therapy, and exercise. CD calls the clinic several days after complaining of having the flu. She says she has been nauseated and vomited once during the night. She says she has had 2 loose stools. Upon questioning, she states that she does not have a few chills and might have a low-grade fever but does not have a thermometer to check her temperature. She states she did not check her glucose level this morning or taken her insulin because she has not eaten. Let's now have your high 5 critical thinking questions. First, CD was started on sliding scale Lispro or Humalog 4 times daily and Glargine or Yolanthos insulin 30 units at bedtime. What is the most significant difference between these 2 insulin? Again, CD was started on sliding scale Lispro, Humalog 4 times daily, and Glargine or Lanthos insulin 30 units at bedtime. What is the most significant difference between these 2 insulin? Number 2. CD states that she knows people who take NPH and regular insulin and wants to know why she can take them. Explain the advantages of using Glargine or Yolanthos and Lispro or Humalog insulins. Again, CD states that she knows people who take NPH and regular insulin and wants to know why she can't take them. Explain the advantages of using Glargine or Lanthos and Lispro or Humalog insulins. Number 3. Identify important content to be included under pharmacologic therapy. Again, identify important content to be included under pharmacologic therapy. Number 4. Identify important content to be included under glucose monitoring. Again, identify important content to be included under glucose monitoring. Number 5, the last number, CD states that she currently does not exercise at all. What benefits will CD receive from participating in an exercise program? Again, CD states that she currently does not exercise at all. What benefits will CD receive from participating in an exercise program? Please answer these critical thinking questions based on the format in your case analysis. Let's now have your daily duty requirement deadline. For day 0, Sunday, and that will be our case scenario loading. For day 1, Monday, you're going to submit GO, SO, DPA, excluded duty expectations, physical assessment, pathophysiology, drug study, and nursing care plan. For day 2, that is going to be Tuesday, you're going to submit your specific objectives, daily plan of activities, your survey for day 1, sample nurses notes FDAR of day 1 and day 2, discharge plan, and reflective journal reading. And for week number 2, follow the case study written requirements. This will be your case study requirements. Of course, you'll have your introduction. It's followed by the nursing health history. Next is physical assessment, anatomy and physiology, pathophysiology, diagnostic tests, drug study, problem lists, a nursing care plan, discharge plan, learning outcome, and of course your references following the APA style of reference taking. Let's now have the deadline of submission. For day 1, the deadline is February 8, 2021, Monday 11:59 p.m. For day 2, the deadline is February 9, 2021, Tuesday 11:59 p.m. For week number 2, the deadline is February 13, 2021, and that's a Saturday 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. This has been my contact details. Please don't forget to send me an email if you have questions, and of course, please contact me in my mobile number if you have further questions regarding the case. This has been Nurse Jose at your service to make your best better. To God be all the glory. Thank you. See you soon.